Hi, Bother Brigade. Here's what's bothering me today. We're here to talk about several different timelines and timeline of events that have been happening throughout America and Canada. This will probably touch on a lot of very terrible, awful things. In other words, this will absolutely be a depressing episode and a very special version of the Sunday Sum Up. There isn't going to be a lot of good, but there is going to be a message of, I guess, hope, if you want to call it that, near the end. But with that being said, let's get started down this very dark and terrible timeline of events, beginning on December 17th, when Forbes ran an article titled "How Omicron Evades Natural Immunity, Vaccination, and Monoclonal Antibody Treatments." So, you know, that's fun, right? Knowing how we, again, kind of just failed. And if you couldn't tell, that's what this is about. This is about America, Canada, and just the West in general giving up on this virus, giving up on meaningful action to save public health and our systems and to save people's lives. This is about the abject failure of leadership from people in what's supposed to be some of the most advanced nations on Earth. So in the wake of reading this article, someone decided to rather accurately point out, we are so fucked. And that was on December 21st, 2021, which was also the same day that the following absolutely horrific news came out. Delta CEO asks CDC to cut quarantine time for breakthrough COVID cases. Because come on, think of his bottom line. It's not like he's already a multimillionaire leading a multi-billion-dollar company, all while, again, travel and stuff allows for the spread of variants, including potentially worse variants, which brings us to, again, the Forbes article that showed, oh, here's how this variant could actually break through a bunch of these things. So, there's no getting a handle on this unless we do the right goddamn thing. And this is certainly not the right goddamn thing. And people know this. Flight Attendants Association President Sarah Nelson criticizes the CDC for shortening quarantine period from 10 days to 5 days. Nelson says this doesn't focus on public health at all, but it was all about the staffing issues to satisfy corporate America.
You talked about, is the CDC citing the science here as the driving force behind this decision, but you said the fact that it aligns with the number of days pushed by corporate America is, quote, less than reassuring.
Look, it was totally transparent here. This was asked for as these staffing issues were being put in place. Delta's statement after this policy was put into place had not an ounce of public safety in it, but it was all about the staffing issues. That's what was argued on the front end. That's how your segment started today. And that is the quick response from CDC in the middle of this holiday season to try to address that, rather than be focused on public health policies.
Yep, that is absolutely right. This is not about actual public health. This is about lining pockets with even more money during a time of unprecedented, obscene wealth. And do you want to know what's also absolutely terrifying? Some people saw this coming back in September. According to Marxist Mark and the Socialist Bunch, which is a fantastic name, by the way, the CDC itself will produce studies to support a political or economic narrative. CDC, 6-foot distance. Some politician in New York, we can't open schools with 6 feet space, we need 3 feet. CDC, here's a new study, 3 feet is good. Meanwhile, MIT found it could travel 27 feet. And then they provide a link from a webpage and an article that shows how it went from 6 feet to 3 feet. This is sadly real. How school distancing went from 6 feet to 3 feet. In our original strategy, we recommended that physical distancing should be at least 6 feet between people based on available evidence at the time. And to no one's surprise, we quickly heard that this was a challenge for many schools given their current physical layout and the number of children. Yeah, it's almost like capitalism has ruined education. Spoiler alert for an episode in the future, but they have just been crowding kids into schools rather than actually funding schools. Politicians looked at schools and said, we will never reopen schools if we are forced to comply with these 6-foot distancing guidelines, but we could reopen if it was 3 feet. We need studies showing 3 feet is safe. And even then, right, I'm hoping that people remember some of the absolutely dystopian images we saw back during the earliest attempts at school reopening in the earlier parts of this god-awful pandemic, where teachers were showing, doing what we can, but I still got, 30 to maybe 40 students to cram to this tiny classroom. Here's like a single piece of plexiglass in front of my desk. This is what we have to work with. Like, it is so objectively horrifying, and unfortunately, we are just getting started. Since the initial release, CDC scientists have been actively reviewing the latest science and conducting their own studies to expand the evidence base, including that evidence on physical distancing. Walensky was unable to contain her laughter when she then added, "We are grateful for them moving so quickly to produce new evidence that we could act upon." Holy shit. Look, we can't actually do the right thing. We have been forced by this shitty capitalist system to do anything other than the right thing. Please produce results that are in accordance with capitalist values. So I guess we should really just talk about how the CDC, new isolation measures were met and also derided. On December 27th, 2021, Fauci just admitted on CNN that the decision to shorten the isolation time was to get people back to work faster. We're no longer even pretending to have the best interest of the people in mind, just the bottom line. Biden signed that $770 billion defense fund bill, said COVID ain't a federal issue, it's on the states, fuck y'all, die, then hopped on his helicopter and took off for his beach house while the CDC said to hell with 10-day isolation, we down to 5, 'cause capitalism. Remember when Biden said he would get this virus under control if everyone voted for him? In case this wasn't obvious to you all, the CDC's new recommendation to shorten the quarantine period from 10 to 5 days is a business decision, not a public health decision. Really awesome how whenever the CDC changes a guideline, it always seems to line up with corporate interests. Science is cool like that. Yeah, I love how they even came right out and said that if your job is having labor shortages, just knock a few more days off your quarantine. I hate it here. Same. And that last one was on December 28th, by the way. And then December 29th, which again is just, a few days after these announcements were made about the shortened isolation period. Again, at the behest of a fucking airline company CEO. In case you're wondering how those new CDC guidelines are playing out in real time, here's my sister-in-law. She's also vaxxed and boosted. Day 5 of COVID and I still tested positive. Extremely tired, congested, headache, coughing, and body aches. Generally feeling blah. Bonus to this awesome experience, my work told me I won't be paid the 10 days I am out. Who needs to pay bills and eat anyway? Thanks, COVID. This is going to be an unmitigated disaster. And again, folks, we are unfortunately just getting started. On December 29th, 2021, Nina Turner posted something that I think we can all relate to. Make it make sense in response to an article titled CDC Director Says COVID Isolation Rules Were Changed to Encourage People to Do the Right Thing. Yeah, because, that's been so easy to do with all the non-measures and the, do not comply and, don't wear a mask, don't get vaccine, and all this other terrible fucking horse shit that we have seen well over a year now. The CDC is just ridiculous. And that's so unfortunate because when there is good information or good protocols to follow, it unfortunately means that now their own authority is directly being questioned and challenged, and rightfully fucking so, because of their bullshit, and also by them trying to comply instead with the needs of capitalists rather than with the needs of public. And then again, the CDC also has the audacity to put out ads like this. My job puts me at high risk for COVID-19 exposure. I got vaccinated because it's better to be protected than to be out sick. I'm not letting COVID-19 take my shifts. Find your free vaccine at vaccines.gov. Jesus fucking Christ, I hate late-stage capitalist dystopia so much. As Tristan Puig says, this government ad alone should be enough for me to claim refugee status for literally any other developed country. So that's everything in relation to how we got to this point and the CDC shortening the isolation period. So now let's get to the rest of the bigger picture timeline in the United States before we hop north of the border here to Canada. So on December 24th, we had a vibe check from New York. If you want to know the vibe in New York, a friend of mine who works retail tested positive for COVID, and their boss told them to come in and just don't tell anyone. On Christmas morning, I saw the following. My wife has COVID, feeling fine, and I can't find a test anywhere. The next open appointment near me is Thursday. We live in a failed state. Is it right to call it a failed state or a capitalist state? It's so hard to tell the goddamn difference these days. On December 26th, good old Boxing Day, Yeah, there's no way I'm going to just accept that COVID is the norm and that we'll all just get it eventually. Utterly absurd how much I've heard folks say this recently. Everyone will get COVID. We should let it run its course. Pandemics will end eventually. Is eugenics rhetoric, by the way. Yeah, it absolutely is. And unfortunately, there's a astonishing and horrifying large amount of people out there saying this eugenics bullshit. But again, folks, unfortunately, we are nowhere near done with this goddamn gong show. Also, right on fucking cue, just a few days after the CDC shortened its timeline for COVID isolation, there were some articles by news organizations that started to make some rounds, basically trying to normalize some of this crap. The New York Times, bosses have a new headache. How long should sick workers isolate? News Concerns copied them. Bosses have a new headache. How long should sick workers isolate? So, consider the News Concerns one if you don't like the New York Times paywall. The only New York Times headline I was able to see, so maybe they changed it, I don't know, but it was the following. CDC faces pressure to change isolation guidelines for sick workers. Facing staffing shortages, companies are weighing conflicting guidance on when employees who have tested positive for the coronavirus can safely return to work. Hey, maybe if there's a labor shortage, we can address that in ways other than just forcing people back and get sick. And then just, that just makes the labor shortage even worse while people are staying. But instead, they're saying, no, you know what? Instead of that, you just got to power through it and infect more people and result in more hospitalizations and the collapse of the healthcare system, which, again, folks, like I said, this is a real gloom one. We are getting to that. At least some people have sense, like this person here who tweeted out on December 27th, sorry if I got COVID, I'm doing the full 15 days. Y'all have lost your minds. Again, continuing down this dark and terrible timeline of the past 2 weeks. If 30% of people who catch COVID develop long COVID symptoms and the plan for the Omicron variant is to just let everyone catch it, that means our government is fine with possibly allowing a third of the country to become disabled. Yeah, it's kind of weird and deeply concerning and also very unsettling that we haven't seen nearly as much talk and media coverage about long COVID symptoms. But anyway, there was more stuff to be seen on December 27th. Really unsurprising and disappointing that we couldn't just shut down for like 2 to 3 weeks and get rid of COVID. Oh, if only it were that simple. Everyone's going to get it is eugenics. Are we all clear on this? Apparently not. And you know what? Governments are fine with that. And that is fucked up. What's also fucked up is how this whole prolonged crisis is affecting things in a myriad of ways and just compounding problems, including, very crucially, food supply. The Safeway in North Pole is wiped out. Cashier says they're waiting for supply trucks, but between COVID and climate crisis, shit is iffy. That's from the town of North Pole, Alaska. And yeah, between the climate crisis, which again, hey, remember how Alaska recently had like 20 degrees Celsius weather again in the dead of winter? Fun stuff, right? But the COVID crisis is also exacerbating this in terms of labor, not just at the stores, but also in terms of being able to get the stuff moving to bring it to stores. And unfortunately, this brings us to asshole chuckle fucks like Dave Portnoy. Good politic guy Mac is the one who actually quoted this tweet, but here's what he is saying in response to Dave Portnoy. We are averaging 1,500 deaths per day. The United States is a death cult. Yep, and Mr. Portnoy is very much a fucking symptom of this. He had the audacity to say that nobody is dying from COVID. CDC just said to treat it like common cold. People are acting like it's a death sentence. What are we doing here? Life is short. You don't get back the days you waste being scared. And then to cover his tracks, right, he has the audacity to say, for the literal police, and yeah, I know people are dying, but people die from stuff every day, including the flu. Omicron is not killing people in any sort of fashion that everybody should be drastically altering their lives. Again, good politic guy Mac pointed out that 1,500 people are dying per day. In fact, that was back then. That average now is over 2,000 a day. In what fucking world is that acceptable to anyone? And with all this crap, right, trying to keep all of this horrificness in mind about, shortened timelines of isolation, and you got to get back to work, but also, try and get testing. Here comes the fact that testing is just increasingly difficult and impossible for a great many people. December 28th, 2021, my sister had an appointment today for a COVID test, but the COVID testing place is now closed because everyone working there got COVID. No joke. This is where we are now. This is America, best nation on earth, right? Which, speaking of, can't talk about America without fucking Florida for a hot second. So, the best briefing and example being set by somebody in public office in Florida comes from the Agriculture Commissioner. This state really needs help. Funny how chucklefucks like Ron DeSantis and Doug Ford all love to disappear once flare-ups are happening. Great leadership for the people that they claim to support and represent. Or, you know, like famously, Joe Biden just saying, you know what? Fuck it, it's a state's issue, and I'm just going off, literally turning his back on the goddamn country that he promised to help, by the way, and has delivered none of that, all while, again, statements like this come from the White House. Omicron cases are on the rise, but it's clear that vaccines and boosters are making a difference. Vaccines and boosters help prevent severe illness and death. If you haven't already, go get your vaccine and booster. However, pay close attention to their COVID-19 cases versus deaths and what the numbers are. I like how they anchored the y-axis really close to the line to make people feel like 2,000 deaths per day is low. So, you know, sure, vaccines and boosters are making a difference, and this is good because it means we don't have as much death as we currently do. But, you know, we could be doing a lot fucking better. We could be having a lot less death, which, you know, maybe that would help with the labor shortage that people are whinging about. But no, instead we got to do classic media manipulation and put big numbers really low on the graph to make you feel like, oh yeah, that's really low to the bottom line, so that's good, even though that bottom line could be, you know, 1 million of something, or in this case, 2,000. 2,000 dead Americans every day, which for those of you keeping track over the start of this second part of this timeline on Christmas Eve, December 24th to now, December 29th, that is just 5 days, meaning in that short period of time, 10,000 Americans died. At least 10,000 from this alone. Never mind other complications, or they couldn't get into surgery on time, whatever else it may be. At least 10,000 Americans died because America is a fucking death cult. And what makes it even more horrifying is revelations from people like this. None of us signed up for forced infection as a condition of employment. And that was on December 30th, right? So we're only 6 days into this. And, you know, when I first saw that, I thought, oh, geez, yeah, you know, fuck, that's rough. But it was the following one that damn near broke me. At a COVID funeral where no one else is wearing masks. It is all so unfortunate, and it all could have been so avoidable. But unfortunately, this is kind of just par for the course for the terrible awfulness that is neoliberal capitalism and economics and necropolitics. See again John the Duncan's video on that. And then on New Year's Eve, some more revelations from people, which, well, rather, they shouldn't be revelations, but unfortunately they kind of are, as more people kind of realize the absolute depths of hell that we are all currently living in. It's been this vibe for a while, but the federal government just made it crystal clear they've been culling the population of undesirables, which, last time I checked, is some Nazi shit. It is so clear that in the States, and again Canada, which we are getting to very shortly now, they have just completely given up, and that is so beautifully illustrated by this person. Alpha, COVID is a serious threat to everyone. Delta, we need to get back to normal. Don't worry, only the most vulnerable will die with vaccines in place. Omicron, let's just let everyone get it, vulnerable or not, and see who's left in the end. These policies are murdering disabled individuals at disproportionate rates, and they are simultaneously disabling formerly non-disabled individuals at disproportionate rates. There will always be a disabled population. Choosing eugenics century after century to try to eradicate us is not a sound policy. We'll always be here, even as wave after wave of us are sacrificed to poor public health policies for economic benefits. Plan with us and for us, rather than against us. Which I guess brings us to the healthcare professionals and the state of nursing. Remember how nurses and other frontline workers were heroes? And, you know, we were banging pots and pans and stuff like that in a symbolic show of support and like clapping, you know, hey, thank you for doing your part. But now guess what? You know, clocks run out. Got to get back to work to satisfy the capitalist elite who actually don't give a fucking shit about any of us unless we're shareholders, because that's where they get their money and their bonuses. And so unfortunately, they also, you know, people like the Koch brothers and whatnot, they put out this garbage bullshit and just so many right-wing grifters just doing things purely in opposition because that's all they fucking have is I can't have any positions of my own, so I basically identify myself in opposition to what the other side is saying. It's basically like the Canadian identity but for reactionary conservative politics. And it's resulted in all this terribleness. Well, it's partially resulted in all this terribleness. And so unfortunately, the nurses are starting to ask questions, right? Why do you trust me to treat you when you get COVID, but you don't trust me to prevent you from getting COVID? Yeah, you know, we're going to trust medical science only when it suits my personal value system and belief model. It is so fucking stupid. And again, this whole issue, or rather these compounding issues, are resulting in there being no beds, as this nurse posted on TikTok.
One thing that I wish more non-medical people understood when they bring up the survival rate of COVID is that no beds in the hospital means no beds, means no beds. No beds for your stroke, no beds for your heart attack, no beds for your car crash, no beds for your sick child. No beds means no beds. And you might be very comfortable with the survival rate of COVID, but how comfortable are you with the survival rate of a massive M1 MCA stroke with no TPA because we can't accept you at any of your local hospitals because our ED is overflowing with patients already? Are you comfortable with those odds? I bet the fuck not. Right now, we have roughly 16,000 ICU beds left in the country. I give us a week and a half. That might be too generous. Last January was some of the darkest shit I've ever seen in my life. Shoveling dead bodies out to refrigerated trucks in parking lots. And the worst days that we had were still only averaging 3,000 deaths a day from COVID. And we are looking at 10,000 deaths a day in early February. No beds means no fucking beds. You die alone at home. Your parents die alone at home. Please, please start listening to the healthcare workers when they scream for you to fucking help us.
And then we also have, to finally transition it seamlessly into the dystopia that is happening and unfolding here north of the border, we have this tale of nursing from the province of Ontario. Seems like no one in government is seeing the disaster that's happening in healthcare. The ER was 6 nurses short on Christmas Day, even with triple time and half pay. Tonight, there's only 1 registered nurse on the cardiology floor. One nurse, people. Only 1 showed up. The morgue is full. Patients been dead since 5 p.m. but nowhere to put the body. 3 ICU patients waiting in the ER. No ICU nurses to take new critically ill patients. There are empty beds but no nurses. The nursing crisis is harming every aspect of healthcare. Urgent help is needed. My heart is really hurting because I know patients are suffering. I see it. The nurses showing up are broken and tired. Yes, I sound like a broken record, but this is because nothing has been done. These are human beings, for crying out loud. Help us save lives, please. And this nurse has some good ideas. Let's start by utilizing the internationally educated nurses we have on ground. They can help. Someone do something. Stop ignoring the outcry to save whatever is left of the healthcare system. Yeah, because basically, not just in Ontario, but in many parts of Canada and the West in general, the healthcare system is on the verge of collapse because we are still trying to satisfy the needs of the capitalist elite. But yeah, since that story was from Ontario, I guess it's time to kind of focus on this province now. We're also going to touch on some other bits from Canada, but for the most part, this is going to be about this absolute nightmare of a province. So while the capital of Ontario is Toronto, the capital of Canada is Ottawa, the second largest city in Ontario. And in Ottawa, it's, the capital city full of government workers. You'd think maybe of any of the large Canadian cities that kind of have this on lockdown because people have the disposable income and savings and pensions and whatever to stay home, self-isolate, get the tests, etc. And, it was doing really well for a while, last I checked. But on December 24th, 2021, it's almost time for Ottawa media to report our by a mile pandemic record case count without mentioning we've long since hit our testing capacity, our rationing testing, and aren't counting positive RATs. So if that's what's happening in a, firmly middle class or upper middle class city, I wonder what else is happening in the rest of the province. On December 25th, 2021, there was an interesting comparison made between Ontario and the Netherlands. In the Netherlands, they have free on-the-spot PCR tests, and there are rapid tests on every street corner for €4. They went into lockdown about a week ago. In Ontario, with a similar population, the government has just given up. And I absolutely love the ominous title of that article. We're locked down again in the Netherlands. Here's a warning. So let's go through and see just how terrible things have gotten in Ontario. Again, the most populous province in the entire country of Canada. December 27th, 2021. I didn't think it was possible to get to a point in the pandemic where governments have basically just given up, but that's the only explanation for the almost total lack of action in Ontario over the past week. Rapid tests unavailable, PCR tests unavailable, N95s unavailable, back to school plans unavailable, 10,000 new COVID cases every day, seeding an expected 1,000 plus new cases of long COVID daily, and Doug Ford, our premier's on holiday. As We're in Hell points out, this is a very normal place to live. Meanwhile, on December 28th, over in the Atlantic province of Nova Scotia, there was the following revelation. Nova Scotia government and public health have basically abandoned the public in favor of the economy. 2 years, we did everything right, and now they're just like, fuck your sacrifices, economy wins. Yeah, Nova Scotia was one of the few provinces in this country that had a really good handle on COVID-19 from the beginning. They listened to public health experts, they locked down early, and, when they had to, and they were doing the right thing for a long time, but now it's just, whatever, just let the dystopia consume you. Come on. Haven't you thought about how sad the capitalist billionaires are? So again, if people can kind of keep some of the timelines in mind, around this time in the United States was also shortly after the CDC had shortened its guidelines, right? And, that has a fucking ripple effect, unfortunately. Breaking, Ontario Chief Medical of Health Dr. Moore's press conference has been postponed until later this week. Minister C. Elliott's office says due to CDC's recommendation on shortening quarantine period, Dr. Moore is reevaluating this guidance against Ontario-specific evidence. But yeah, apparently, in light of the CDC's new recommendations, the province of Ontario decided, maybe we should do the same thing. So we're going to postpone this current planned announcement, and we're going to go back to the drawing board real quick. Again, against Ontario-specific evidence. Oh, and around this time again, even though tests were just becoming increasingly more difficult to find, especially, publicly, there was this lovely revelation. Only $180 and you can get a PCR test in the Eaton Center. Healthcare for those who can afford it. I fucking hate this timeline so goddamn much. Yeah, this is the government, the progressive conservative government of Ontario that cares about people. And they also care about children, which is why on December 28th, this person pointed out how much they actually really care. If we were truly concerned about the mental health of students, we would decrease class sizes to 15, improve air quality, assign mental health staff to schools, and stop making every aspect of child development the sole responsibility of teachers. Whoa, hey now, spitting too much truth for the conservatives here. Which again, right, that problem of just absolutely putting too much on teachers in an impossible and capitalist system, while also making testing unaffordable for a great many people who, probably have kids too, right? And then there's also, again, unfortunate revelations. The everyone is going to get COVID anyway, aka no/minimal restrictions crowd, conveniently never talk about unvaccinated kids, people with chronic illnesses, the elderly, or racialized communities with much higher rates of death and illness. The casual eugenics of back to normal. yeah, you know, we gotta get back to normal, but I don't remember that normal being this dystopian. It was dystopian, sure, but this is objectively fucking worse. And again, on the subject of testing and back to normal in this hellscape of a province that was at this point in time, again, December 29th, getting ready to copy the CDC's guidelines, we were still hearing stories like this. My coworker's husband works for Walmart. Today she tested positive and her husband is also symptomatic. She told me Walmart is not accepting rapid tests as proof of infection and he will be without pay until he can get a positive and a negative PCR. That's good to see. But then again, it doesn't help when you are again hearing stories about how business leaders are just saying, well, you know what? You just got to come into work. Case in fucking point. Just found out about someone with confirmed contact whose boss told them to come into work anyway because they can't take time off. We're really fucked, aren't we? Yup. In fact, again, going back to the city of Ottawa, here's some terrifying news from that city. Ottawa's Queensway Carleton Hospital is in a bad way according to Reddit. Code Orange refers to a community disaster. Internal Code Orange and situational update according to Dr. Andrew Falconer. Omicron has made its way into our homes and our hospital. The situation has changed significantly in the last week and it is important that everyone understand the current context. Essentially, we are in an all-hands-on-deck situation right now. We have more than 40 staff who have tested positive for COVID, with more coming in every day, and we are seeing significant staffing shortages in multiple areas. Today, the emergency department is very busy with 23 admitted patients, including several that are COVID positive. There has been a lot of additional pressure on staff and physicians working this week. We cannot thank you enough for your skill, compassion, and resilience. QCH, Queensway Carleton Hospital, has had to call an internal Code Orange. Again, folks, this was happening on December 29th, just a few days ago. So that's the situation with regards to, you know, hospitals, including in like very big, developed, relatively wealthy, well-off cities, and it's already an unmitigated disaster. Meanwhile, on the ground, PCR and rapid tests are not available. Contact tracing has collapsed. There is no vaccine mandate for educators. Many children have only one dose or none. With only 5 days left, can someone ask the Ontario government what their plan is for opening schools and keeping them safe? I mean, you can ask them, but you're not going to get a fucking answer from them because that's how they roll up here. And they're just going to copy, spoiler alert, whatever America's doing. Which brings us to December 30th. Ontario just adapted the CDC's bullshit 5 days things. Fuck this province. Another person summed it up equally beautifully. LMAO, Ontario is severely restricting access to PCR tests. There's basically no rapid tests available and is shortening the required isolation period. We live in a failed state. Again, failed state, capitalist state. But don't worry, the free market of capital will provide. Ontarians with positive rapid tests are struggling to get appointments for confirmatory PCR tests. But if you've got $350 handy, you can get your test results in an hour at private clinics popping up across the GTA, which is the Greater Toronto Area, but there was a bit of a hiccup with that. Ontario residents livid after province drastically cuts eligibility for COVID PCR testing. Oh boy, I see where this is going. Oh, and by the way, that same day, December 30th, the Western Prairie province of Saskatchewan had the following. Saskatchewan reducing COVID-19 self-isolation period to 5 days for fully vaccinated residents. Sure, okay, that's for fully vaccinated people, but again, it's like, oh, okay, so we're just copying the CDC even though it's objectively bullshit? Yeah, cool, Canada's totally a real and sovereign independent country. But what was really telling, again, to bring it back to Ontario and the focus here, is that during that press conference where they said why they were shortening it down to 5 days, they really just went mask off. 5 days is less burdensome for some employers, says Dr. Moore in the shortened isolation period for COVID-19. Quite the mask off moment. We are screwed. We are so unbelievably screwed, as Joy Henderson points out. We are so screwed. Like, I really have nothing more than that. Our government has basically washed its hands of this crisis. This is what we get when we vote for people who have had everything in life handed to them on a silver platter. It's pure fucking chaos out here. It absolutely is. And then you have other stories of people where, you know, they got lucky, but they at least have the self-awareness to see how none of this system actually fucking works. I was lucky to get a PCR test, which helped make me eligible for 2 days of COVID sick days. What will happen if there's no formal proof of possibly having COVID or not? Luckily, I did not have COVID. Yeah, that's a great fucking question. So you need a PCR test in order to get COVID sick days, but those are basically unavailable publicly, and you have to basically pay a massive amount of money, and even then the eligibility has been reduced. What the actual fuck is going on here? It makes no goddamn sense. Welcome to the neoliberal nightmare that is North America. Which, as an opinion article from the Globe and Mail kind of points out just, you know, how depraved the capitalists are and how poorly our leaders have handled this. We're in the you're on your own stage of the pandemic. And I swear I'm going to come back to this, especially near the end, which we are mercifully getting closer to, but we still have a few more days to cover. So then on December 31st, New Year's Eve, just, 48 hours ago, basically at this point, there was, again, just some further unfortunate highlights of the situation in Ontario and Canada in general. Ontario government, assume you have COVID and take 5 days off. Employers, we are not giving you 5 days off unless you have a positive test, which you don't qualify for. Speaking of things a lot of people don't qualify for, one of which is the Canada Workers Lockdown Benefit, and it's a fucking disgrace, let's be real here. The Canada Worker Lockdown Benefit is actually $270 a week, as $30 is withheld for taxes for the few who qualify. And again, crucially, December 31st, New Year's Eve, we got the following breaking news from Ontario. Ontario reports more than 16,000 new cases of COVID-19 as hospitalizations continue to rise. And that same day, that same goddamn day, you want to know what the Ontario government did? Ontario to stop collecting COVID-19 numbers from school boards, suspend reporting of cases in schools. Happy fucking New Year, Doug Ford, Stephen Lecce, and all the criminal scum in Queen's Park. Like, this is actually illegal and against rules. Someone proved as much. Are you aware that this directly contravenes the Ontario Education Act, which requires administration to report communicable diseases? See at Norm's World for a citation. Here's that citation. Worth remembering that principals still have a duty to report infectious disease outbreaks as mandated by the Education Act. You know, the law. Here's the literal statement. I'm not going to read it because my voice is getting real hoarse, but there you go. Feel free to pause it and read this. It is right there in the law that says they have to do this. But the government's saying, no, you know what? We'll just do this thing. They will take action on the worst possible things to try and artificially make the situation look better than the unmitigated fucking disaster it is. Can we get some real action for once, either provincially or federally, please? But then unfortunately, again, right, we've talked about a few fucking douche canoes on here, so here's another one. Jesse Brown somehow verified. The sense you get from news media to social media is that things are as bad or worse today than a year ago. That's absurd. Vaccines are a miracle and most have little to fear. We can still care for others while acknowledging that a gift from science delivered us from a plague. So, shit's still going on, my guy. As Pinko Punko points out, skyrocketing case numbers, cutting isolation time to save employers money, drastically reduced testing capacity, no protections for workers, privatizing testing, no sober leadership on provincial/federal level, most meaning able-bodied people. Vaccines are great, but what? Hey, it's great. I'm vaccinated. The vast majority of people I know in my family and friends circle are vaccinated. But, it's still a goddamn pandemic outside with record cases and also still crammed ICUs and ICU capacity. We've seen this numerous times over the course of this one fucking video. And again, it just touches back on that overarching theme of eugenics. And again, all this is happening while our Premier Doug Ford hides, while Florida Governor Ron DeSantis hides, while Justin Trudeau is still off on vacation. Remember that whole super important and necessary September election? Because, he was just so tired of the opposition not working with him to try and get help to Canadians that Canadians so really need and deserve, right? So, we had to have the election to hopefully give him a majority so that he could, do the good work and help us. And then they didn't go back from September until November, and then they sat for like 20 or 22 days, and then they decided to take a break until the end of fucking January. We are still not going to see any federal government for a month. Our governments are silent while things like our healthcare are privatized. Yes, privatized. Socialist.ca ran this article that touches on the point that we made about the $180 PCR test, which is just capitalism. But then they are also quoting someone, a nurse practitioner, who was saying, you know, geez, like what? So if you don't have money, you don't deserve healthcare? Precisely. Yeah, exactly. That's what this government wants. This conservative government wants to just chip away at public health care because they want that good private stuff that, you know, their donors really are pushing for, because clearly that's working out so well in America, right? And then we have media, again, owned by corporate interests, saying absolute garbage like this, trying to normalize the situation. Faster than ever, COVID-19 spread has us wondering if getting Omicron is inevitable and what that means for the virus's long-term future. Oh boy, okay, where to start? Precautions still need to be taken, and we're going to come back to that whole Omicron thing, but we're still trying to go through the timeline of events, right? And so just earlier today, there was this. So many high-risk friends are childcare workers and educators. I am so scared of losing them. Why the hell was the message everyone went with, we must open schools and take precautions, instead of we can't open schools unless a ton of new precautions are taken? Because unfortunately, we've given up. We being our leaders and like a good chunk of society, namely the conservative side of society. Even Bedrino is calling out Ottawa's bullshit. Opening schools with no testing? Schools were responsible for like 40% of cases before Omicron. This is a flat out lie. Opening schools with no testing is criminal. Because apparently Ottawa Public Health, like for the city of Ottawa, they're saying, hey, you know what, we're not going to introduce testing because testing is basically expensive and unaffordable and unreachable. And there's, you know, the different qualifications, right? You see how there's like 10 or more different compounding problems to this bullshit dystopia? There's the Toronto Star putting out terrible opinion pieces like that, trying to normalize the situation. And mercifully, there are people pointing out why this is terrible, such as this person here. Omicron is not a Pokemon-style final evolution of SARS-CoV-2. It's still mutating rapidly, including in the spike protein. And with the amount of replication it is doing out there right now, we can expect new variants. Hoping is not a strategy. Giving up is not a plan. But unfortunately, that's what our leaders have done. Our leaders in the West, whether it's in Britain or in Canada or in the United States, and with all the, you know, anti-lockdown protests from people who are saying, we got to get back to normal, even if it means death, in Australia, the Netherlands, America, Canada, etc., right? Like, across the West, this is the unfortunate and grim reality. And here in Ontario, this is basically the summed up timeline of gross negligence. November 28th, Omicron detected in Ontario. December 16th, COVID-Sci Ontario recommends an immediate circuit breaker. December 17th, last time Doug Ford addressed Ontario. Waits for modeling to show up in hospitals. January 2nd, today, Cabinet meets to discuss a circuit breaker. Too little, too fucking late, my guy. I wonder why they decided not to shut down for Christmas, even though a lot of people ended up not being with their families for Christmas, seeing the terrible skyrocketing numbers, and not wanting to take that chance. It's capitalism. It's all about this fucking system that is pushing us further and further down an even darker and worse dystopia than some of us could have even possibly imagined. The situation is so beautifully summed up here. No free tests, no free masks, no lockdown, no stimulus, no fucking compassion or leadership. My coworker tested positive. My work is thinking of closing for a while, and there's no support at fucking all. We're supposed to protect ourselves, nurse ourselves, trace ourselves, fund ourselves, isolate ourselves. And while I'm on this, what is this superiority complex people have regarding COVID precautions? Are we going to continue blaming every large-scale crisis on individual actions? If I wasn't constantly doom scrolling on Twitter, I would still be wearing a cloth mask, I would still feel safe unmasking around other vaccinated people, and I would still feel safe going to establishments that require proof of vaccination. Because there is no lockdown. There is no stimulus. Everything is open. There are no kits and masks being sent out. There is nothing outside of social media and word of mouth that is urging anyone to be safe. I'm admittedly not the most educated on what's available right now, what kind of response every state has had, what the numbers are. If you have more info than me, I'd love to hear it, and more power to you. I'm just as tired and frustrated as the rest of us. And that's really just it, right? There's no support, and we're expected to do everything on our own. And I think that's where the hope kind of comes in. But I still want to focus and hone in on this part and this person's frustrations. Because no doubt all of us feel this in some capacity, right? The fact that we're supposed to do all this on our own rather than our governments. And it's like, then what do we fucking keep you around and pay you for? Yeah, maybe we should actually do all these things ourselves and just not listen to your authority anymore. Maybe this is unfortunately the point where we say, well, you know what, screw it. We're just going to loot these expensive tests because it was our tax dollars that paid for them anyway. And we're going to form our own distribution networks, etc., etc. And maybe that's how an honest to God revolution actually begins in this nightmare land. But you know, it shouldn't have to be this way. It shouldn't have to be so chaotic, but unfortunately it is, because the people in power only see one thing, and that is money. And it has meant that they have given up on the very thing that allows that system and that money to be generated in the first place. Biden literally turned his back on the nation, especially after promising to help people, that he would get this under control. Everything, we're like, you know, the 2,000 checks out the gate, I'm going to get this virus under control. There should be a federal solution. And now here he is literally saying, you know what? Fuck it. And he turns around and walks away. Ron DeSantis is in hiding. Doug Ford is in hiding. Mr. Super cares about the people, Justin Trudeau, is still off away from the actual work of leading for another month. This is all so absurd. But again, there is some hope to be found, and it actually came from that person's final explosive rant at just the absurdity of this whole situation. Our leaders have abandoned us, and as much as that part about, you know, we're supposed to protect ourselves, nurse ourselves, trace ourselves, fund ourselves, isolate ourselves, yeah, you know, that's kind of what a lot of people do already, at least out in the country. See my previous video about how conservatives are practically leftists without even realizing it. These are all things that, you know, we can do. That's the hope, right? It's not to say that, you know, we should all start doing this right now, because where to begin? And we still have to go to work, and, you know, change is scary, right? Like all these other issues, I completely understand. And that's not what I want to push on people. Instead, what I want people to think about at the end of this just god-awful nightmare video, there is hope. And the hope is that what we can do is to keep each other safe and close. Because unfortunately, our leaders have abdicated all leadership and responsibility, which means they, in a way, are also signaling that they're abdicating any real power or authority. If they aren't willing to lead, and we being our communities, have to do so, well, then we don't really have to listen to the people in power anymore, because, well, no, you surrendered, you gave up. Why should I listen to you when I'm the one having to do these things? And in another way, this is also the capitalist class tipping their hand. If the labor shortage, which again is due to all these various factors, is so incredibly acute that the isolation period needs to be dropped to 5 days, which is still just only going to exacerbate the labor shortage and the healthcare crisis in general, right? But if they're saying that, you know, oh, geez, that's still just too much, then really what they're also admitting is that a week to maybe 2 week long general strike would absolutely break them. It would force them to concede. Apparently, that's the razor's edge that they live on. And, you know, maybe there's some additional hope in that. Not just in terms of, well, why should we listen to you and your authority? You've basically given up on us. Guess it's time to give up on you and build some dual power structures and organize a general strike, because you played your hand and showed us the timeline that we need to know to potentially cause your collapse. And that still says nothing about its potential collapse through the healthcare crisis or the, again, what will just be an exacerbated labor crunch and shortage. Maybe one of the things to do is, while our governments and leaders are basically in hiding or on vacation, or just basically acknowledge that they're giving up on everything, maybe now would be a really good time to begin organizing for said general strike. So yeah, if you've watched this long, thank you so much. and for putting up with all of this. But again, I want people to know that there is hope. They've overplayed their hand. We can begin organizing. We can basically start not listening to these assholes in power and start actually holding each other close and begin the meaningful work towards a actual meaningful improvement of the situation. But unfortunately, we're not going to see that from our leaders, which is so deeply unfortunate. Why are we paying these assholes such incredible salaries where they barely sit for Parliament or Congress and just decide, no, you know what? I'm not actually in charge. It's the businesses that are in charge. Why do we have these people around then? What authority do they meaningfully have left in terms of the abdication of responsibility to the people that they're supposed to be held accountable to? It's all just so ridiculous, absurd, horrifying, and dystopian. And if it wasn't clear, it's definitely what's bothering me today.